The COVID-19 pandemic has forced most businesses to temporarily shut down in order to help stop the transmission of the novel coronavirus. Others, however, such as grocery stores, must remain open as they are considered an essential service. And as the pandemic continues, there's been increased pressure on the government and employers to provide their employees, who in many cases are some of society's lowest paid workers, with hazard pay.
Hazard pay is extra pay awarded to an employee if they're working in a situation where there could be harm to their physical well-being or some sort of physical hardship.
That's Stephen Tufts, an associate professor at York University who studies labor, as well as labor market adjustment and integration.
It's used in a number of sectors, mining, construction. It's even used in diplomatic sectors, so you can get hazard pay when you work in a war zone, for example, if you're working for the government.
According to Tufts, the litmus test to determine if an employee should receive hazard pay is if the person's normal work cannot be made more safe with protective measures or equipment.
But the big difference is that you don't receive hazard pay if risk is a normal part of the operating part of your job. So police officers, of course, work in situations that can be very dangerous, but that's part of the everyday working of being a police officer.
However, there have been arguments made that essential workers deserve hazard pay because they're putting their lives on the line, are at a greater risk of being exposed to COVID-19, and have a short supply of protective personal equipment.
It's supposed to reflect the idea that right now going into work puts people, particular workers, at increased risk for infection and even at death. So in this moment, many of us are being told to stay home. And that's a really important directive that I know a lot of people are taking very seriously. But meanwhile, there are workers for whom staying at home is not an option.
So who determines who gets hazard pay and who doesn't?
In the unionized context, the union and the employer will collectively negotiate what the pay is. In a non-unionized context, the employer has full leeway to decide what the pay is and whether or not to provide hazard pay up. That is, in both contexts, unionized or non-unionized, it is subject to some provincial government limitations. And so a key one is, for example, the Employment Standards Act, which says that no one can get paid below minimum wage.
According to Tufts and Carter, there isn't a set minimum dollar amount when it comes to hazard pay. And in Canada, some grocery store employees have seen an extra $2 per hour added to their pay, while frontline workers, such as nurses, are still demanding compensation.
I don't think nurses are doing this because they want monetary compensation. There's also a symbolic recognition of just how dangerous it is for healthcare workers at the moment.
To me, hazard pay is not just about money, but it's also about, showing a token of appreciation and support, really. And I think for a lot of nurses, they're increasingly having to deal with more and more patients, a much higher volume than they're used to. They're strapped for personal protective equipment and effective cleaning supplies, and they're managing drips and vents and things that are much more complex than they're used to. And they're saying, hey, something's got to give, guys. And one way that their administrations or their government can show them that they really care about what they're doing, I think, is by giving them hazard pay, kind of reaching into their pockets and putting their money where their mouth is.
In Canada, Prime Minister Justin Trudeau announced plans to boost the minimum wage for essential workers making less than $2,500 per month, as well as better support for long-term care employees. In the US, President Donald Trump said he was looking at providing hazard pay for healthcare professionals. As well, the Democrats are looking at including hazard pay for frontline workers in the next coronavirus relief package.
I think a lot of people have realized that this hazard pay thing needs to happen, that Americans are at risk and that it's their duty as the government to protect them. It's really heartening for me to see that both sides of the aisle, for once in the United States, are agreeing on something, right? That we need to protect the American people and that hazard pay now needs to be a thing.
And even though there are a lot of pros to hazard pay, there can be some cons too. including workers feeling obligated to go into work, even if they feel sick themselves.
One of the reasons that these jobs are dangerous is not only because of increased exposure to work, but that if to the virus, but that they can't stay home, because if they do, they lose pay. They're not getting sick pay. So we have a lack of sick pay, we have a lack of mass testing, we have a lack of protective equipment. All of these in concert are making vulnerable workers even more vulnerable.
I think that's an interesting argument. I think the way to combat that would be to just, for a set period of time, so, from the beginning of March through at least the end of May, and then you can keep extending that, say, no matter if you're at work or if you're home sick because of your work, you still get hazard pay either way. To encourage people, that would encourage people, if you're sick, to stay home, right? Because you're getting paid the same and you don't have to work, right? So I think that's a valid argument, but I think there are ways around it.
As the world tries to work together to help curb COVID-19 and support its essential workers, it's also important to highlight all workers during this pandemic, including janitors, grocery store workers, truck drivers, and postal workers.
So I'm talking about phlebotomists who are drawing their blood. I'm talking about respiratory therapists who are in there when the patients are getting intubated. They're the ones making all the changes to the patient's vents. There are transport personnel who are rolling the patients from the emergency room up to the ICU or up to the COVID floors. There are x-ray techs who are coming in to take x-rays to see what their lungs look like. These healthcare workers spend more time with COVID patients than I do. It's just the matter of their job. I see the patient once, I do my physical exam, I come up with the plan, and then I monitor them using video equipment and looking at their labs on the computer in the safety of my own little workspace, wearing my mask, right? But these other healthcare professionals do not have that same privilege. And I don't think they are getting the praise or the payment that they deserve.
Thanks for watching. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel, where we also dig into big issues around the world in our weekly series, Global News Explains.